thanks for the chance. I would like to introduce myself. My name is Nuzul Ilham Ramadhan. I'm fourth year student in Physics Department from Bandung Institute of Technology. In this occasion, I will take your 10 minutes, so if you have question or comment, please ask me after I finish my presentation. Or you can comment on my YouTube channel. My topic is about treatment planning system for breast cancer. Why I do just this topic? Because breast cancer is the second type of cancer that caused death in Indonesia, and several issues have been reported regarding delivery errors due to miscalculated dose in treatment planning system. This error can be caused by a failed selection of diagnostic device to detect cancer, can also be caused by a failed selection generation, failed size, and number of beam. My topic is divided into three subtopics, that is imaging for breast cancer, technique for planning breast cancer, and optimization treatment planning system. As you know, cancer is a disease in which cells experience abnormalities and form many uncontrolled cells. In the case of breast cancer, cancer forms cells in the breast, usually in the vessel that drain milk to the nipple. Imaging breast cancer is very important because with imaging, we can collect information about location, size, and shape the tumor target. As you can see, there are several devices that can be used for imaging process. Imaging in radiotherapy has three goals: to provide more accurate target shapes, to precisely define the target of the radiation treatment, and to define the radiation beam portal for its direction of radiation. We go to the X-ray radiography. For medical imaging, X-ray pass through the body. They are absorbed or attenuated at the varying levels based on density and atomic number of the different tissues. Treating a profile, X-ray that have higher energy will pass through the body or attenuate and make the film detector dark or black. Matter that have higher atomic number will absorb the X-ray and make the film light or wet. Benefit the X-ray radiography is non-invasive, quick, and painless, and then support medical and surgical treatment planning. The risk is exposure to ionizing radiation. This increases the possibility of developing cancer later in life. And then tissue effects such as cataracts, skin reddening, and hair loss, which occur at relatively high level of radiation exposure. And then the risk of X-ray radiography is cause a biological damage. We next to the imaging device. There is a CT scan. CT scan is a diagnostic technology that combines X-ray equipment with a computer and cathode tube display to produce image of cross-section of the human body. The radiographic film is replaced by a detector which measures the X-ray profile. Its profile is reconstructed by the computer into two-dimensional image of the slice that was scanned and then the computer reconstructed to provide three-dimensional image of complex structure. The benefit of CT scan is non-invasive, quick, painless, good spatial resolution, and since there is no film involved, resolution is not limited by field quality, distinguished by small difference in physical density, and more functional. But CT scan have ways too. There is exposure to ionizing radiation like X-ray radiography. This is increase the possibility of developing cancer later in life. And then with CT scan is no real-time information, less contrast resolution where soft tissue contrast is low. Okay, we go to the MRI. MRI or magnetic resonance imaging is a diagnostic technology that uses magnetic and radio frequency field to image the body tissue. The benefit of MRI is non-invasive, painless. MRI is using magnetic field, so this device not using ionizing radiation, and then high spatial resolution, good soft tissue contrast. But MRI have the risk. There is long scan and post-processing time, no real-time information like CT scan, and then in this device, patient will lay on the patient table. Because of the narrow space, some patient can feel claustrophobic. We go to the next imaging device. There is USG or ultrasonography. Ultrasonography is a diagnostic technology that uses high-frequency broadband sound wave in the megahertz range that are reflected by tissue to varying degrees to produce medical image. The benefit of USG is non-invasive, painless. USG is using sound wave, so this device not using ionizing radiation. High resolution, and the result of image is real-time information. But USG have the risk to there is time consuming since this device using sound wave, so we need good medium for propagation of sound wave if there's an empty medium like lung, so it will lose contact or signal. And the last for medical imaging is about PET or spexivity. Nuclear imaging is a diagnostic technology that uses small amount of radioactive material to produce image of internal body. Radionuclide imaging include the technique that is PET or positron emission tomography and SPECT, single photon emission compute tomography. The different PET and SPECT only in detector because PET releases into gamma ray from inside body. The benefit of nuclear imaging, provide functional information that is often highly accurate and specific, and then a good tissue specific contrast, and can check how far a cancer has spread and how well the treatment is working. But nuclear imaging have a risk too, that is use ionizing radiation and make the patient radioactive for a variable period of time, and then it's high cost for patient. We go to the second subtopic is about technique for planning breast cancer. Like imaging, technique for planning breast cancer has a goals too, that is to provide the maximum dose in cancer organ and give the minimal dose in organ surrounding cancer organ. In general, technique for planning is in cancer patient are many ways, like ABRT, brachytherapy, IRT, chemotherapy, and others. ABRT, we go to the ABRT. ABRT is a type of radiation therapy that directs a beam of radiation from outside the body toward cancer's tissues inside the body. Before treatment starts, a patient will meet a doctor or nurse. He or she will tell the patient how the treatment works and how it can help you. The patient will also learn about any side effects to expect. The radiation therapist will put small mark on your skin. This mark show where to aim the radiation. How does the treatment work? The first is ABRT delivered radiation to the tumor using a LINAC or linear accelerator, and then this machine, which sends radiation beams to the contour of the tumor, allows the delivery of radiation from any angles as it moves around the patient. This treatment can be designed in such a way that they destroy cancer cells while sparing the surrounding normal tissue. Patients don't feel anything during the treatment. Brachytherapy is from radiation therapy where radioactive source is placed the tumor either direct adjacent inside the tumor itself. How does treatment work? Your doctor will place small holder such as thin tube called a catheter into your body. It is placed in or near the cancer cell. Then the sheet, ribbon, or wires are put inside the small holder so that the radiation can reach and destroy cancer cell. The applicator are then attached to a computer controller, machine known as an afterloader. The afterloader sends small radiation source down the catheter to the treatment set in the breast, and it is left in place for a predetermined period of time. After the set period of time, the radiation source is transferred back out of the applicator and into the afterloader. Depending on the type of implant you receive, the radiation source may stay in place for minutes, hours, or days, or if you receive a permanent implant, it will not be taken out. The last technique is IRT, or intraoperative radiation therapy. The word intraoperation means radiation given during the surgery process directly into the site of the removed tumor. How does the treatment work? The first is surgeon remove the tumor, leaving a cavity where the tumor was located, and then the radiation oncologist places the applicator into the cavity. Next, the applicator is removed and the surgeon closes the incision. Radiation is given to the surrounding tissue for 20 until 30 minutes. And the last subtopic is about optimization treatment planning system. Important thing about optimization is maximizing or minimizing some function relative to some set, often representing a range of choice. The function allow comparison of the different choice for determining which may be best. Number of beam. It's important because with number of beam increase, then the dose will also increase too. However, the increased number of beam can increase the coverage area of the target cell so that the destruction of cancer cell is more optimal. Another way to increase the coverage area of target cell so that this destruction of cancer cell is more optimal is to expand the size field, but like the number of beam, the field size increase the dose in the area it plays. The way to reduce the dose due to the addition of beam amount is by reducing the weight factor of each beam. The value of weight factor ranges from 0 to 1. Gain rotation is related with cancer cell position and organ at rest. We must fit the angle. We must fit the angle with the cancer cell position, because when we set the cancer rotation, it means that we regulate which part is passed by radiation beam. Thank you.